While every other developed nation in the world manages to have universal health care, advocates for Medicare for All are typically asked about how the plan would bankrupt our country.
This was Bernie Sanders' answer to that question on Tuesday. Let's take a listen.
Our plan wouldn't bankrupt the country, and in fact, it would much improve the well-being of working-class families and the middle class. Let us be clear what Medicare for All does. It ends all premiums. It ends all copayments. It ends the absurdity of deductibles. It ends out-of-pocket expenses. It takes on the pharmaceutical industry, which in some cases charges us 10 times more for the same prescription drugs sold abroad as sold here.
Joining us with his thoughts on all this is Wendell Potter, former insurance executive, president of Medicare for All now. He joins us now via Skype. Wendell, it's great to see you.
Thank you very much.
Absolutely. So, Wendell, give us a little bit of your reaction to that clip and I guess answer that question, which is every other country in the world does it. People who are against it say that it can't be done here in the United States. You say that it absolutely can be. Tell us how it would get done.
Well, if every other developed country in the world has been able to do it, why can't we? I mean, my gosh, we're Americans. We think we can do everything, and we certainly can transform our healthcare system to at least be as equitable and cost-effective as other countries around the world. The truth is that the current system is what is bankrupting this country. We're the only leading developed country in which individuals and families file for bankruptcy because of medical debt. It's a leading reason for for bankruptcies in this country. Just 20 years ago, in 1999, the cost of a family premium that you get through the workplace was $5,791. Now it is $20,500. That just goes to show you two things. One, premiums keep going up and up and up every year, but because of the way that we have our system structured, insurance companies cannot, nor do they really want to control healthcare costs. So that is what is bankrupting our country. Insurance companies cannot control medical costs. They actually benefit from rising healthcare costs because as they go up, they just raise their premiums. The other thing is that other countries, this thing of medical bankruptcy just doesn't exist in other countries. And we spend twice as much on a per capita basis, on a per person basis in this country as the average of other developed countries. And our outcomes are worse. We're actually seeing a decline in life expectancy in this country when it's going up in every other country. So it is the current system that is bankrupting this country. Now, that said, Medicare for All can wring out the waste in our system and get rid of the inefficiencies that we just have been talking about and bring down the cost of healthcare in meaningful ways. So it is the current system. If we don't change and move to Medicare for All, we are all going to be facing medical bankruptcy. We can't afford the current.
It seems to me that the biggest barrier to Medicare for All is, in fact, the amount of money that is being made by so many people in the current health insurance and healthcare system. That means that there is incredibly well-funded opposition, and with money in politics being what it is in this country, it seems to me that the biggest barrier isn't like a technical or logistics or can we afford it barrier. It's actually a political barrier of having all of that industry opposition leveraged against trying to affect any real change that would benefit American consumers.
No one knows that better than I because I used to be a part of that. In fact, my last book is called Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. And I, chapter after chapter, describe how various industries wield their influence in Washington and state capitals in various ways, through campaign contributions, through spending enormous amounts of money on lobbying and disinformation campaigns like we've been talking about. So you're exactly right. We've also got to tackle the influence of special interest. Even Trump campaigned on cleaning up the swamp, and we've seen that's not really been happening. But we really need to get serious about that. Before we get to, I do agree. I think that getting to Medicare for All is obviously going to be a heavy lift. First of all, it is going to happen. It's inevitable because it's the only policy that really makes sense ultimately. But we're going to be held back until we can do something about the influence of big money.
So one thing I want to get with you, Wendell, which is why is Medicare for All, in your view, the only way to cut costs? Because I have seen a lot of others, because I agree with you, the premise, I think it's unacceptable, the current system. Why is it that Medicare and single-payer government-provided health care is actually the only way to rein in costs and not various maneuvers of antitrust and some other government regulation?
Just one thing, a semantical thing. It is we're talking about publicly financed healthcare and privately delivered healthcare, which is maybe sound like nuance, but it's important. We're talking about finding a new way to pay for healthcare, not deliver it. We would still have a system of doctors and nurses in private practice.
Right. It's not a national health service. Right. Understood.
Exactly.
Yeah.
But when you look at just maybe adding a so-called public option, first of all, details matter. You really need to know what it is the candidates are talking about when they say public option. So that's very important. But one of the reasons we spend so much is because of the inefficiency of having multiple payers. That's exactly why we spend as much as we do. When you have a large number of insurance companies in a given market, as we typically do, none of them are big enough to really negotiate in an effective way with big hospital systems or big physician groups, certainly not drug companies. So that is the basic reason why we can't control healthcare costs. And just adding a public option, in my view, particularly if it's one that's really weak and not very effective, is just not going to get us to where we need to be. We've got to, we've all theoretically in this country have access to healthcare. So that's not the main issue. It's that we can't afford it. Even those of us who have health insurance can't afford to get the care that we need. We talked about medical bankruptcies. It is because, many people who have insurance are those who go to GoFundMe to beg for money to pay for care they can't afford. That's why.
For me, as long as you have the pigs at the trough, still profiting off of keeping people unwell and denying care and sending them into bankruptcy, you're not going to have real change. Wendell, thank you so much. It's always great to have your perspective.
Thank you, Wendell.
Thank you so much. Pleasure. Thank you.
We'll have more Rising for you after this.